So Kyle, it's been, what, about 4 months since you've had your crown placed on your implant.
4 months, yeah.
How's that work for you so far?
Oh, it's great. I can't even tell that I have a fake tooth.
Okay.
Yeah, it's great.
That's good now.
I can chew on ice and everything.
When you originally knew you wanted to get that replaced, you probably had some options. What made you decide to go with an implant?
Well, if I remember right, Dr. Coates talked about an option that I'm not sure what the term of it was, but it required grinding into both teeth on either side of the damaged tooth, and those teeth were fine. I think that was the biggest thing that convinced me, was just instead of destroying, or not destroying, but grinding into two teeth just to replace this one, and it seemed like the way to go.
So how was the overall process for you?
Oh, it was great. The only part that I remember any pain was just the actual tooth coming out, and the healing of that. There was like a week there of kind of, you know, just didn't feel very good.
How would you compare like having the implant placed with the extraction, which is easier?
Oh, the implant part is it's not even comparable to the extraction of the tooth. I mean, there's no pain involved. I think I remember, I'm pretty sure I remember just after, you know, most of those procedures, just not really having any pain and just leaving, and everything seemed fine.
That was good. Excellent. Would you recommend this to your friends?
I already have.
You have?
Yeah,
Okay.
I've actually, there was a buddy of mine that had a similar situation where a tooth broke off and there was part of the tooth still hanging on, and but you know, he hadn't seen a dentist yet, and I told him all about the implant. Maybe you'll get a call.
Excellent. Great. You know, Allison, we've worked together on, you know, quite a few implants now, and do you notice anything different the way maybe implants are being done now versus maybe 15 years ago when you're just getting started?
Well, I certainly do. That's much less trauma on the patients. The patients are comfortable throughout the procedure. There's little or practically none post-operative discomfort. Patients are very satisfied with the procedure. The success rate is very high, and it's easy for me to convey to a patient that this is their choice when they have a missing tooth, that this is the route that they should take.
Are they usually resistant at all, or once you explain the rationale for an implant, do they pretty much accept it?
The two resistance that I usually get are they're worried about discomfort, and they feel it's a very invasive procedure, so they're scared, and cost. And when I can explain to them that the discomfort level is going to be very minimal, if any at all, and the cost, when you look at the big picture in life that they're investing in the future, it's a much better alternative than conventional.
How about for you? Are implants a good thing for you on a professional
basis? It's great.
basis?
I'd like to do them all day long.
Okay. Why is that?
Well, basically, aside from the treatment planning and the discussing with the patient and the interaction that you and I have from the restorative point of view, it's the easiest dentistry I do as a restorative dentist. No, don't have to give any anesthetic to the patient. They're comfortable throughout the procedure. You do a lot of the work for me. And so it's a very simple part for me. As long as I know that I've got enough space and it's a good candidate for the implant, it's easy. I'd love to do them all day long.
That's a big difference from maybe the way implants were done 15, 20 years ago, isn't it?
Absolutely.
Would you say it's kind of a little bit more like doing regular crown and bridge now?
Much more than it was in the beginning of the implants.
You know, I don't think all practitioners have the benefit of, you know, years of experience working together. What would you say to some GPs that were maybe just getting started in implants in terms of what they should look for in a partner to work with, and maybe also in a system?
Well, certainly the communication is the most important thing between the oral surgeon and the restorative dentist. I've appreciated working with you over the years. It's been great. You're always take into consideration any complications of the case, anything I might be thinking about that'd be a problem, and you take the time to go over the cases ahead of time with me, as much time as we need to make sure everything's going to go smoothly for the patient. So I think you need to have a surgeon that's willing to communicate with you and take the time, whether it's phone calls, emails, whatever is needed before the case is even started, and then throughout the case.
Do you ever feel like you wish you could do more in the case? Sometimes I've talked to some people starting out, and they say, well, it's so easy, all I have to do is cement a crown. Is that something that like keeps you up at night worrying about?
I certainly don't worry about it, but it's very true. I feel like I don't do very much and you do everything, and I appreciate working with you. And I do feel a little guilty sometimes.
Oh my goodness! Oh, I think it's important to say that it's on the tail end that the oral surgeon probably does a lot of the work. I think that the treatment planning, as you mentioned, particularly in more than a single unit case, is really important. And as you already alluded to, you need to have that communication. So that's a good thing. Good. So Allison, that's a great response, and I'm really flattered. You said all those nice things about me. What about the system? I know there's a lot of great doctors that you work with out there. Do you think there's anything that you would recommend anyone regarding a type of implant system?
Well, what I would like to see in a system is something that doesn't have a lot of pieces to work with, and it's going to make it more like the traditional dentistry that I'm used to doing. So something with little pieces, simple, like crown and bridge that I'm used to doing, restoring for patients that I've been doing for years and years, will make it as easy for me as possible.
Mm-hmm. That case we did with Yolanda Moreno, was that pretty easy, just being able to take the impression with a little snap cap?
Absolutely.
Okay.
Yeah.
Good.
I really like this system to work with. It's been easy and the results have been great.
Great.
So Yolanda, I know years ago we wanted to talk about straightening your teeth, and then we had that one tooth that we needed to actually take away to make a perfect result. And then we talked about getting an implant. And are you happy with what we've done so far?
Yes, I'm extremely happy.
And how was the procedure of going through getting the implant compared to what you thought it was going to be like?
Actually, I thought it was going to be more painful than what it was. I think the extraction of a tooth was the most pain, but getting the implant in was a piece of cake compared to that.
Yeah, that's great. And how was working with Dr. Silegy?
He's an excellent doctor, very personable, walked me through the entire step, told me exactly what was going to happen, and there was no pain, which was good.
That's great. That's what we want to hear. So then when you came over to my office, I felt like everything went really smoothly from my end. The results turned out really nice. And how did you feel how that went when you came over to my office for the restorative part?
It was great because we wanted to match the color of my teeth with the crown, and we got that done, and I really like the results. No one can tell that I have an implant. I can't even tell I have an implant.
And aside from that it looks good, how does it feel for chewing?
No problems. No problems at all. Actually, my jaw feels much better because I used to pop a little bit before because I think my teeth weren't aligned, but now it's great.
So was there ever a question in the beginning of you getting an implant to replace that tooth versus some other conventional way too?
Well, I didn't know much about it, but Tim had told me exactly like what it was and what the benefits were, so I like that better.
Good. That's great. Well, we're glad you're happy.
Yes, thank you.
Hey Yolanda, thanks for coming and chatting with us today. I think ours is kind of a unique story, and it's an interesting story. I can remember meeting you at the gym, and you're saying that you had a little bit of a bad bite, and asked me what you think maybe you should do about it. And it turns out you had a deeply impacted tooth that had kind of some weird little funky pieces around it, right?
Right.
So you had seen someone else, and what did they tell you?
They told me that, actually I saw two doctors, and one doctor said to leave it alone, and another doctor said eventually I would probably have problems because there was a tooth with another tooth, and then my teeth were eventually going to shift. So,
had you noticed that tooth was drifting just a little bit?
I did notice it, and I think the main concern was that he said that I might lose sensation in my lower lip because of the nerve. So I wanted to find someone that I get a second opinion at least.
Okay, good. And you've been seeing Dr. Emery for a while, right?
Yes, I have.
And she'd mentioned to you before that maybe it'd be good to address closing that space?
That, and she wanted me to put me into an Invisalign first. And then I think when I went to go see an orthodontist, they told me there's no way that my teeth were going to shift because I had that problem with that extra tooth.
Well, you embarked on a big journey.
I did.
We did it together.
Yes.
It was what, probably all told 2 years?
About 3 years.
About 3 years.
From
and that
the-
began with what, taking the tooth out?
With initial surgery.
And then doing a little bit of a bone graft.
Yes.
And then I think we put you in braces after
Put
that.
me in braces.
And how long was that for?
Well, we started with Invisalign, and then we went to traditional braces. So over, I think it was about a year and a half altogether.
Okay. And during that time, you were like training to be an FBI agent, right?
I was trying out for the FBI.
I remember that, yeah. And so we finally got the teeth kind of close to where they needed to be.
Yes.
And the bone graft had healed, and we placed the implant. What was it like having the implant placed compared to, you know, having the tooth out and that sort of thing? Do you think it was hard, or that was the easy part?
Not at all. I think the implant was the easy part. I think since I didn't even really feel it. The surgery, I think, was tougher because you had to cut and take out, and then it got infected. But I think the implant was very easy.
And do you have sensation on your lip now?
I have more.
More?
I think I never got the 100%.
Not 100%, but you're pretty
I've got
close.
a lot more, yes.
That's good. Excellent. So, how do you think things turned out overall? You're happy with your smile?
Definitely. I always get compliments. I like the way my teeth align, and my jaw doesn't crack anymore or pop. But I definitely like the way it looks.
Does it feel like you have an implant, or does it just feel like a natural tooth?
It feels natural to me.
Okay. You know, you were fortunate. A lot of times it's not just finding one great doctor, but finding a bunch of really good doctors that work together. And I think your case really demonstrated how vital it is, especially if it's not a slam dunk kind of case, to have a lot of really competent doctors on the team. Did you get a sense of that, of the interdisciplinary work between the orthodontist, Dr. Sugiyama, the restorative dentist, Dr. Emery, and myself?
Definitely. It was a nice team to work with. Everybody was on the same page. I think everyone had talked to me about what results I wanted, and they were definitely glad to be included.
So actually, we had a 4-member team, with the doctors, and then of course you were one of those team members, right? The vital team member, I guess, right? And when the time came to get your final crown, did you see there was any shift in continuity, or everything just went very, very smoothly?
It went very smoothly. I was telling Dr. Emery I really enjoyed the fact that we matched the color of my teeth to the crown. I got something custom done just to add the finishing touch.
Well, in talking to Dr. Emery, that's one of the things she really liked about working with me on this case, and also the system that we use, that it made it like any other crown and bridge type case, where she could provide you that excellent aesthetic result. So it's good. Let me see you smile. Oh my God. Look at that smile, guys. I should put you in an advertisement. That's good.